Ladies and gentlemen, this is an article that came out on December 21st in Knox News, which is part of USA Today. Report substantial hepatitis C infection increase tied to opioid epidemic. And I have done stories in the past on how really all of the hepatitis A, B, and C are just exploding across the nation because of all the needle sharing that's going on. I mean, I think all the needle sharing going on in this nation is record breaking at this time. So here's a video. I'm going to go ahead and play this video.
Across the U.S., soaring use of opioids has forced tens of thousands of children from their homes, creating a generation of kids abandoned by addicted parents.
What's your favorite fish to catch?
Tiffany Eggers of McCordsville, Indiana, started fostering Eli as an infant. He was drug positive.
When I got him at 4 months, he reeked of some sort of substance. It literally took a week to get this horrible smell out of his hair, out of his saliva, out of his feces, out of his urine.
Today, Eli is a healthy little boy. The Eggers family adopted him, but will never forget the difficult process.
He's very colic. He just kind of screamed. And now I look back on, I think he was just traumatized.
Though substance abuse has long been an issue for child welfare officials, this is the most prolific wave of children affected by addiction since crack cocaine use surged in the 1980s.
He was born on methadone. They sent him home, and then he went in a severe withdrawal.
Shawnee Wilson grew up with addicts and was 13 when child welfare officials removed her from her home. Now, at 26, she's trying to beat heroin, having already lost custody of 2 children and given another up at birth. Her 4th child, Kingston, was born just over a year ago, and it took a month for doctors to wean him off the heroin Wilson exposed him to. He is in foster care now in Indianapolis, and Wilson is fighting to get him back.
It's hard. It was harder at first, as I was still struggling more with addiction, but now it's making me stronger for when he comes home.
New foster care cases involving parents who are using drugs have hit the highest point in more than 3 decades of record keeping, accounting for 92,000 children entering the system last year. The crisis is so severe, with a 32% spike in drug-related cases from 2012 to 2016.
I came to Indiana and I was floored at what I saw here.
Dr. Tara Benjamin is a maternal fetal medicine specialist. She treats women with high-risk pregnancies.
When I walked into the labor and delivery unit, there's always a whiteboard, but they had a list of patients with the title "Do Not Prescribe," and it meant if these women call, they're probably seeking, so don't prescribe for them. I had never heard of that in life. To me, that was an indicator of how bad this epidemic was here.
In the state of Indiana, drug-related foster cases shot up more than 6-fold between 2000 and 2015.
I read the report and I just burst out crying.
Judge Marilyn Moores has been on the front lines of helping children affected by the horrors of their parents' addiction. Her burden is making the right decision for families according to the law and her heart.
We had a 2-year-old that was found in a home. The neighbor heard him screaming. And thank God the door was unlocked, and the neighbor went over and found the 2-year-old in the home. The dad was dead of a heroin overdose with a needle in his arm, and no one knew how long the 2-year-old had been in the home.
The opioid epidemic is destroying communities and families. Meanwhile, thousands work towards...
Well, that's amazing. Some Black man got that thing pregnant. It is really bad out here, y'all. And I can't believe she done have 4 kids addicted to heroin. She doesn't even have not a tooth in her mouth. And and she's really not that old. I know she looks 8 up, but she's not that old. United States overall rate of hepatitis C more than doubled between 2004 and 2014 among people under 40. It increased by 300 to 400%. The reason for the jump: transmission through injection opioid drugs, which we know already. It's a lot on, no matter how much they try to prevent needle sharing out here among these addicts, it still goes on. It just goes on. Hep C, part of opioid plague. Now, here are the states that are deeply impacted by hepatitis C infection from drug injection. 4 states: Tennessee, Virginia, West Virginia, and Kentucky. And found a 200 to 300% increase in the number of infected people who inject drugs. So, whew, man. And the people that are most infected, 400% increase among 18 to 29-year-olds, and 300% increase among people ages 30 to 39 years old. At the same time, the infection rate among people with risk factors other than injected drugs use didn't see the same increases. Because hepatitis C infection doesn't always cause symptoms immediately, and because such a small percentage of people addicted to opioid drugs receive substance abuse treatment, both the number of cases and the increase in them are likely much higher. Wow. So there's a lot of people that can actually have hepatitis C and transfer it to other people and don't even know they have it because they don't feel the symptoms of it. The moral of this story, ladies and gentlemen, don't lay around with somebody that's on drugs. That's really what it comes down to. You don't know what these people are going to give you at that moment when you're having sex with them. It ain't worth it. It is seriously not worth it. Ooh, please tell me what you think. Please leave your comment and subscribe, and don't forget to hit on that notification bell. And please join me over on Black Junction, ladies and gentlemen. Watch the videos, like the videos. And if you happen to have your own Black Junction channel, please let me know. That will give me an opportunity to subscribe to you. Peace, family.